Ange from HOSPO Health. I'm talking to you now about some of the issues with this mental safety concept and how it might apply in hospitality. In hospitality, customers can be a source of connection and pride, but they also represent a common source of risk factors such as exposure to violence, abuse, harassment or pressure. Hospitality workers, particularly females, report some of the highest levels of sexual harassment at work. Similarly, co-workers can make all the difference in helping you deal with a stressful day at work. Many of us are lucky to have strong friendships at work, which promotes our mental health considerably. But unfortunately, the opposite of that, workplace bullying, can be a risk factor for suicide. And the laws and procedures around stop bullying actually came out of a suicide, tragically, of a young person working in a cafe business. So we need to remember that how you design your procedures, policies and practices are an area of critical focus for preventing these problems and encouraging the positives. You need to be able to demonstrate to a regulator or a court of law that you've assessed the potential for these risks and that you've taken what's called reasonable action to eliminate or mitigate some of them with documented controls. Well-known controls for the risk of aggression in customer service environments include things like clear signs communicating the company has a zero tolerance policy of abuse of staff. It could also include building and workspace design that provides physical barriers that prevent violence. It could also include staff training in how to de-escalate aggression. These can all be helpful, and they're all things that may reduce the risk of a very common workplace hazard. Codes of practice, as I mentioned earlier, are currently being developed in all states and territories to assist employers in developing these sorts of controls. But essentially, you just need to have some kind of process in place. If you work on your own, then it might just be a self-care plan, regular debriefing with people who understand your work. It might be changing an aspect of how you work with your clients or other businesses. It could be working with a mental health professional on matters of what we call occupational hygiene or mental fitness to create better self-awareness and strategies for how you manage and integrate your work and life. A small business that employs staff might do things like discuss mental health and safety at induction, so all staff know they're valued by the business and they're aware of any relevant policies and procedures. You could consider the risk factors in staff meetings and ask your staff to contribute ideas for preventing and managing problems. Try to create a problem-solving culture around workplace stress and mental health. You could look for industry guidance and support via business groups such as the Tasmanian Hospitality Association, but also government services such as WorkSafe, Tasmania's Health and Wellbeing Advisory Service. Link up with other types of similar businesses to share ideas and supports. Finally, if you're a larger organisation, you'll need something more systematic to ensure you've consulted widely with people from different areas of the business and with different types of workers. Risk assessments are often done using anonymous surveys, focus groups or other processes of observation and expert input. Psychosocial risk controls need to be developed and integrated within your wider safety management system.